I just imagine praying every day since I've been laid off from my job. I've been laid off for like over 2 years. I imagine that God will bless me with another job.
I imagine it to be a lot better than what it is now.
I really am. That lots of work.
I definitely think about having a family. I guess long term, it's going to be me doing something that I really love. Not really sure what yet, but probably in education somehow. And then just still being really close to my friends and family. So yeah, I definitely think long term like that, but I don't really think about, hey, I'm going to live till 80, then kick the bucket. That's not really what I think about.
I think I'm gonna live probably about 75, 80 years. That's what I think, but who knows?
I think about it when I think about God. I say, well, when it's my time, it's time to go. That's when Jesus called me. When it's my time. But yeah, I do think about death being out here in these streets.
Yes, as I get older, because I'm almost 52, so I think about dying and I think about it a lot.
It's coming regardless. I think about it a lot.
Okay.
I got hit by a car.
Yeah, so I've had a family member with some health issues in the last couple of months. So that's definitely put some things into perspective. But I mean, it's been after, a couple decades. He just celebrated his 50th wedding anniversary with my grandmother. So obviously they've been around for a while. But still, dying, whether you're 100 or 10, isn't something that I think people really want to think about. But yeah, it's definitely something that I think about, I guess, more in it's kind of bureaucratic sense, where it's like, I know I'm an organ donor, I know that I want to be cremated, stuff like that, but as far as the actual one moment you're here, one moment you're not kind of thinking about it, I think I try to avoid thinking about that. Yeah.
I think it's that, but I don't want to die, but I want to life live.
So when we were interviewing individuals, it generally seemed that people who are homeless or in worse financial situations tended to think about death more often. It seemed more of a reality to them than financially stable individuals. In an article that we read for class called Why I Hope to Die at 75, the author is under the assumption that he's going to live to a certain age and he has all these things he's going to do, and then at a certain age he just wants to die. He's a very well-off individual and has the privilege to think about these things because he doesn't have to worry about where his next meal might come from or dying on the streets. So it seems like being financially stable allows individuals to feel more control of their life and future, and then therefore makes death less of a reality for them.
People who are living in poverty or at low income levels tend to face many more obstacles than people who are living in much more financially stable situations. People who have a low socioeconomic status lack access to resources that they need. They are more worried about working and having enough money to put food on the table every day, and they typically don't have the capacity to worry about maintaining an optimal level of health by exercising, eating a healthy diet, or practicing other healthy habits. These people are also affected by the cycle that exists between poverty, disease, and death. Oftentimes, these areas have poor sanitation, a lack of proper nutrition, and other factors that impact health in a negative way. Due to these factors, people have a greater exposure to infections and disease that could easily be prevented if the right resources and infrastructure were in place. Additionally, these areas usually lack adequate medical services. When the people do get sick, there are fewer medical resources available for them, and they are less likely to be treated. As a result, people in poorer areas are more likely to die from illnesses that are preventable.
In Grundy, Virginia, coal mining is the main employment option. In one of the articles that we read for class, a reporter wrote, "For a miner who avoids being crippled, burned, or buried alive, the usual question is which will give out first, his lungs, back, or his knees." Unfortunately, this cycle is hard to break because there are no other large firms that provide employment options in the area, and businesses don't want to come into these areas where the workforce is unreliable and sickly.
When we went to the Dominican Republic, we saw that many of the people there are living in poverty. Whether they live in the rural communities, in an urban setting, or in the Batays, most of the people do not make very much money and do not have access to all of the resources that they need. Two of the biggest health problems in the Dominican Republic are cholera and dengue fever. Due to the improper sanitation system and the lack of clean water, both of these diseases are transmitted at a high rate. Many of the people who are living farther away from the public hospital, who cannot easily access medical services and treatment, are at a higher risk of dying from these preventable and treatable diseases. While we do not know for sure how people living in the Dominican Republic perceive death, it's possible that death is more of a reality to them that they think about more often because of the current circumstances that they are living in.
One of the physicians in the cancer documentary that we watched over the summer mentioned that maybe helping people isn't saving everyone, but maybe it's just helping them have a good death. Some doctors feel this way, but not all of them. And even if they do, the structure of the healthcare system as a business may affect the healthcare delivery. So, for example, we learned about the UCLA hospital and how they tend to stress a more aggressive treatment option. And while it's up to the patient and the family, often if a doctor tells a patient to recommend a course of action, they'll agree and comply. Another interesting thing about how our healthcare system approaches death is we tend to talk more about geriatric care, but not as much pediatric death or at other times in life. So perhaps we're less prepared in that area. In the cancer documentary, they talked about how there was a lot of gray area for end of life decisions, and that seemed to be more when addressing cases with adults and less so in pediatric cases or people who were more in the middle of life.
As more people live longer, our healthcare system is focusing on providing quality healthcare and end-of-life services to the elderly. It's a good thing that our healthcare system is concerned about helping elderly people maintain a higher quality of life before they die. However, it's also necessary for our healthcare system to have plans in place to protect the quality of life for people who die at younger ages. When people are facing life or death situations, they have the option of choosing to do everything possible to survive, or of maintaining a higher quality of life right before they die by choosing palliative care. But because death is not a reality to most people, they do not think about their death, and they're forced to make last-minute decisions regarding their end-of-life care. Our healthcare system would improve greatly if it encouraged people to live in the reality that death doesn't just happen to old people. Our healthcare system would be better if people were encouraged to think about and make decisions regarding their end-of-life care in advance, not while they're on their deathbed. Most importantly, people should be encouraged to consider the quality of life that they want to experience prior to their death, whether it comes at an old age or much sooner than expected. As a whole, the healthcare system should have better plans in place and should emphasize helping patients plan for their future and what will inevitably come.